If you're over 60 and don't wake up with morning erections, don't just chalk it up to age. It's a red flag. Your body is trying to tell you something, and if you brush it off, you're not just missing out in the bedroom, you're giving up your confidence, energy, and even heart health. ED isn't just about sex. It's your body's warning sign for bad blood flow, weak pelvic muscles, and hidden changes that affect your overall well-being. But here's the good news. It's not hopeless. You can fix this. I'm Dr. Laura, a urologist and men's health specialist with over 30 years of experience helping older men regain their strength, stamina, and self-belief, things they thought were gone for good. In my clinic, I've guided men in their 60s, 70s, and even beyond to restore natural erections without pills, using proven methods made for the aging male body. The issue? Most men obsess over testosterone and meds while ignoring the real root cause. Today, I'll show you 4 targeted exercises that boost circulation, strengthen crucial muscles, and bring back sexual function naturally. One of them is so overlooked yet so powerful, it'll shock you. Stick around, the best part is coming up. Before we dive in, if you haven't already, hit subscribe and turn on notifications so you never miss vital health tips tailored for men over 60. If this helps you, drop a 1 in the comments. If not, type 0. Your input helps me deliver better, more useful content for you. Now, let's start with step 1, the most critical move, an exercise that zeroes in on the core of your sexual health, the pelvic floor muscles. Strengthening them can seriously upgrade erection strength and control, especially for men past 60. I'll never forget the look on a patient's face. He was 67, recently retired, and married for over 40 years. He sat across from me, eyes lowered, and said, "I still love my wife, but I just don't feel like a man anymore." He had started losing his erection slowly at first, then completely. No pills helped, but within 8 weeks of a simple daily practice I gave him, he came back smiling. His words, "Doctor, I feel alive again." That practice was pelvic floor activation, or what most people know as Kegels. But unlike what you may have heard, Kegels aren't just for women or for urinary control. For men, especially after 60, this is the single most powerful and natural way to rebuild sexual strength. Why? Because the pelvic floor muscles are directly responsible for controlling blood retention in the penis during an erection. When those muscles are strong, they clamp down and hold blood in the erectile chambers, keeping the penis firm. When weak, blood escapes quickly, leading to soft or short-lived erections. Most men I treat have never exercised these muscles before, but once they do, everything starts to change. Longer, stronger erections, better control during sex, and even a renewed sense of energy and confidence. It doesn't require a gym. You don't need equipment. All you need is consistency. Here's exactly how to do it. 1. Find a quiet place where you won't be disturbed. Sitting or lying down is fine. The goal is to identify the right muscle group. The easiest way is to imagine you're urinating and then try to stop the flow midstream. That slight internal squeeze, that's your pelvic floor. You're not tensing your abs, legs, or buttocks, only that inner muscle. If you place a hand on your belly and feel movement there, you're doing it wrong. This should be subtle but controlled. 2. Now that you've identified the muscle, contract it. Hold the squeeze for 5 seconds. Really feel that engagement deep inside. Then release and rest for 5 seconds. That's 1 repetition. Start with 10 reps in a row. This will take less than 2 minutes. Try to do this routine 3 times a day, once in the morning, again in the afternoon, and once before bed. After about 2 weeks, you can start increasing the hold to 7 seconds, then 10. Gradually, your muscle endurance builds, just like it would if you were training any other part of your body. After 4 to 6 weeks, many men begin to notice harder, longer-lasting performance, and in some cases, stronger climaxes. It's a simple habit, but its impact on your sexual health can be profound. When done regularly, it becomes something empowering. You're not just hoping your body works. You're taking control of it. That's something no pill can ever give you. Diaphragmatic breathing plus pelvic flow mobilization. Now, if this first exercise works so well by targeting muscles deep inside your body, imagine what happens when we stimulate the actual blood flow system that feeds those erections. In the next method, I'll introduce a tool that's used in hospitals after prostate surgery but can also be used at home to restore powerful natural blood flow. Once you understand how it works, it might just become your favorite new habit. Breathing exercise. There's a story I often think about when I talk to my patients about breathing. A man in his early 70s came to see me. He was healthy, active, still working part-time, but deeply frustrated. "I can't relax," he told me. "Even when I want to be intimate, I just can't get in the moment. My mind is racing, and my body doesn't respond." What he was describing wasn't just mental. It was physical, too. Chronic tension, shallow breathing, and subtle anxiety were shutting down the very system responsible for erections, his parasympathetic nervous system. What helped him most wasn't a drug. It was a breathing exercise. It sounds almost too simple to be true, but diaphragmatic breathing, also known as deep belly breathing, has a direct, powerful impact on your ability to get and maintain an erection, especially after 60. As we age, our bodies tend to operate in a state of low-grade stress. Muscles stay slightly tense, blood vessels constrict, and our breathing becomes shallow and rapid without us realizing it. This fight-or-flight state reduces blood flow to the pelvis, precisely the opposite of what your body needs during arousal. When you learn to breathe with intention using your diaphragm, you shift into rest and digest mode. This activates your vagus nerve, lowers cortisol levels, reduces blood pressure, and most importantly, increases blood flow to the pelvic region. That's the exact kind of blood flow an erection depends on. So, how do you do it? 1. Find a quiet space where you can lie down or sit comfortably with your back supported. Place one hand on your chest and the other on your belly. 2. Now breathe in slowly through your nose for about 4 seconds. As you inhale, feel your belly knot, your chest rise under your hand. Hold the breath gently for 2 seconds. Then exhale slowly through your mouth for 6 seconds. Feel your belly fall. That's one deep diaphragmatic breath. Repeat this cycle continuously, for 5 to 10 minutes. You'll notice your heart rate slowing, your shoulders relaxing, and your mind becoming clearer. For best results, I recommend doing this at least twice a day, once in the morning to set the tone, and again in the evening to unwind. And if you ever feel anxious or disconnected during moments of intimacy, take 2 minutes to breathe like this beforehand. It makes a remarkable difference. Over time, this simple breathing pattern helps regulate your body's natural rhythm. More oxygen reaches your blood. Your vascular system becomes more responsive. Erections become easier to achieve and sustain because you're no longer fighting your body. You're working with it. I've seen men who were convinced they were too old or too far gone rediscover full natural erections after incorporating this into their daily routine. And perhaps just as importantly, they felt relaxed and connected again with their partners and themselves. Penile vacuum pump therapy. Blood flow re-education. Now, if you think breathing can help awaken your erection, wait until you see what happens when we introduce a device that literally pulls blood into the penis, training your body to perform again, even after years of dysfunction. The next technique is a cornerstone of erectile rehabilitation, and it's easier to use than you might think. I still remember the first time I introduced a vacuum pump to a patient in his mid-60s. He was skeptical, maybe even a little embarrassed. "You want me to do what with this thing?" he asked, half laughing, half uncomfortable. But I could tell his frustration ran deeper. He'd tried pills, he'd waited, he'd blamed himself, but nothing had worked. 2 months later, that same man walked into my office with a confidence I hadn't seen before. "I'm getting real erections again, doc. Like years ago." That's the power of vacuum pump therapy. Once you understand how it works, you'll see it not as a gimmick, but as a tool to retrain your body to perform the way it was always meant to. As men age, blood flow to the penis can slow due to narrowing arteries, lack of activity, or underlying conditions like diabetes or high blood pressure. Without consistent blood flow, the penile tissue begins to weaken and lose elasticity. That's where the vacuum pump comes in. It works by using negative pressure, gently pulling blood into the penis, expanding the vessels, and stretching the tissue in a way that mimics natural arousal. Over time, this improves circulation and helps restore the natural mechanisms of erection. Using it correctly is simple but crucial. 1. Choose a reliable medical-grade vacuum erection device. It can be manual or battery-operated. What matters is that it creates consistent, gentle suction. 2. Start by applying a small amount of lubricant around the opening of the cylinder to ensure a proper seal. Then, insert your penis into the tube. Hold the base firmly against your body to maintain suction and begin pumping slowly. You'll feel the pressure draw blood into the penis. In a few seconds, it will start to expand and become firm. This isn't about sexual stimulation. It's about training your body. 3. Once the penis is erect, you can maintain the vacuum for 10 to 15 minutes. Some men use a soft constriction ring at the base to hold the blood in temporarily, though this should only be used with proper instruction. The goal is to improve blood flow without causing discomfort or damage. 4. Start by doing this routine 3 times per week. Some men eventually increase to daily use, but always under guidance, and never more than 30 minutes per session. More isn't better. Consistency is what matters most. Over several weeks, men report firmer morning erections, better response during intimacy, and even greater penile sensitivity. It's like waking up a part of the body that's been asleep. Unlike medication, this method supports the natural erectile process, not just a temporary fix. This therapy is especially powerful when combined with the first 2 exercises. You're strengthening the muscles, calming the nervous system, and now restoring the vascular flow, all key systems working together. For many of my patients, it's this combination that finally brings results after years of struggle. Penile extender protocol, the hidden power move, but we're not done yet. There's one more technique that's rarely talked about, often misunderstood, but scientifically backed to support not only stronger erections but actual improvement in length and tissue health. If you've never heard of it before, don't worry, most haven't. But once you do, it might just change the way you view your own potential. A few years ago, a man in his late 60s came into my office looking defeated. He had tried everything: pills, pumps, exercises, but he still felt like something was missing. He told me, "Doc, I don't just want to function again. I want to feel like myself." That's when I introduced him to something he had never heard of before: the penile extender. At first, he was hesitant. He thought it sounded odd, even a little extreme, but after a few months of consistent use, he returned with a quiet kind of pride. His erections were stronger, longer lasting, and he noticed an increase in length that gave him a renewed sense of youth. "I didn't think this was possible at my age," he said, "but it was. And it still is, for any man willing to stay the course." Penile extenders are not well known, but they've been used in clinical practice for years to support men recovering from surgeries, injuries, and age-related decline. What makes them effective is the principle of gentle traction. When applied over time, this traction stimulates cellular regeneration, improves blood vessel growth, a process called angiogenesis, and encourages tissue elasticity, all critical components of healthy erectile function. Here's how to use it properly. 1. Select a high-quality extender device. Avoid cheap generic versions online. They're often poorly made and uncomfortable. The best devices are adjustable, come with padding or support for the glands, and allow for progressive tension. 2. Begin by carefully fitting the device to your flaccid penis. It should be snug but not painful. The tension should be light at first, just enough to create a gentle stretch without any discomfort. 3. Wear it for 30 to 60 minutes per day for the first week. As you become more comfortable, gradually increase the time to 1 to 2 hours daily. Most protocols recommend continuing for at least 3 to 6 months. This isn't a quick fix, but it is a long-term solution. What you're doing is conditioning your penile tissue to grow healthier, stronger, and more responsive. Many men report not only stronger erections but also increased confidence, improved sensation, and in some cases, measurable gains in length. The key is consistency and patience. Think of it as physical therapy for your sexual health. What makes this method unique is that it goes beyond function. It can also help with mild penile curvature, performance anxiety, and the psychological weight that often comes with years of decline. It gives men back a sense of control over their bodies, something that often feels lost after 60. Unlike pills or short-term solutions, the changes from extender use can be lasting. Conclusion: I've seen men not only restore their sexual function with this device but completely reframe how they view aging. For some, it's no longer about trying to keep up. It's about reclaiming their full potential. Now, if you followed this far, you've learned about the 4 key exercises that rebuild erection strengths from the inside out. But don't go just yet, because in the final part, I'll share how to put it all together into one easy-to-follow plan. Plus a surprising 7-second daily habit that can accelerate your results faster than anything else I've seen. Let's wrap this up strong. As a urologist who's worked with men for more than 3 decades, I've come to learn that the most powerful changes don't always happen in the clinic or with a prescription pad. They happen when a man decides to take ownership of his health quietly, consistently, day by day. And if you're still reading this, I believe that's exactly where you are right now. We've covered 4 exercises that, when practiced regularly, can change everything about how you experience intimacy, connection, and confidence. 1. Pelvic floor activation. Building strength at the root. These deep muscles control blood flow in and out of the penis, leading to firmer long erections. 2. Diaphragmatic breathing. Resetting your body's natural arousal system. It helps calm your mind, reduce anxiety, and open the vascular channels that carry blood to where it's needed most. 3. Vacuum pump therapy. A mechanical way to reawaken dormant erectile tissue, improving circulation and oxygenation in a way no pill can match. 4. Penile extender. Perhaps the most overlooked method, but one that offers long-term gains in both function and physical confidence. I get it for techniques. New habits, new routines might seem overwhelming, but in my years of practice, I've found that men over 60 are some of the toughest, most committed, and driven people I've ever worked with. Once they see why this matters, they dive into how to make it happen. And that's when the real transformation starts. These aren't just workouts. They're messages to your body that you're not ready to slow down, that you refuse to disappear into the background, and that you still want passion, energy, and confidence when you look in the mirror. Some guys tell me they regret not learning this earlier. Others say it gave them a fresh start they never imagined. A few admit it saved their relationships. I won't lie, these steps aren't an instant fix, and they won't erase every challenge. But here's what I can promise. They're safe, science-backed, and based on 30 years of real results. Most importantly, they give you control, no more depending only on pills or waiting for things to decline. You shouldn't have to quietly accept frustration or disappointment. You deserve to feel strong, sharp, and totally unshackled in these years. No shame, no limits. Even if you try just one of these moves today, you're on the right path. Thanks for letting me walk you through this. Stick with it, because consistency doesn't just bring better performance, it brings a whole new life.